Hi everyone. So we're going to cover chapter 4 from your visual A&P textbook, and it's all about the integumentary system. And so what I'm going to be doing is basically just clicking through the PowerPoint and just see my little face down here, and hopefully this will make a little bit more sense to you when you hear me and see the slides from your book. So this is the integumentary system. It's really our body's first line of defense. So it's really two main structures that we're talking about when we talk about our skin, and that is the cutaneous membrane, that's the skin itself that you see, and then all of the accessory structures like your hair, your nails, and then all the glands that are associated with the integumentary system, which are called exocrine glands, as opposed to endocrine glands like your pancreas and thyroid, right? So let's talk about the purpose or the main components of the cutaneous membrane. You have the epidermis, that's the outer covering, that's what you see. Your epidermis is showing, haha, right? It's your epidermis. It's made of stratified squamous epithelium. And then you have the dermis, which is composed of two layers. There's a papillary layer, which has like a relar connective tissue. It's just a conglomeration of different fibers and cells. And then below that is a dense, irregular layer called the reticular layer. So the papillary layer and the reticular layer make up the dermis. And then below the dermis, or I should say deep to the dermis, is the hypodermis or subcutaneous layer. This layer is where you have lots of connective tissue, and it's the fatty layer. This is where lots of body fat likes to hang out. So the accessory structures that are associated with the integumentary system, as I said, are the hair, skin, and exocrine glands. There's also something called the cutaneous plexus. This is all of the blood vessels that lie within the dermis and hypodermis. This is the blood supply to the integumentary system. So it's a huge capillary network. And you can see that here, some of these layers coming in. You see the hair, you can see some glands. And then here you see this papillary layer is this top layer of the pink, which it looks kind of wavy. And then the reticular layer is much deeper. It's the bulk of this pink stuff. And then the hypodermis is where you see all of the fat. The epidermis is just this top layer. It's the outer skin that you see, and it's these germinating cells that are deep to that. So we're going to learn all of those structures and all of these accessory structures throughout this chapter. So let's get going. So main function of skin is there for protection, right? It's protecting everything that's underneath of it. It's protecting our organs. It's also protecting us against fluid loss. So not only does it keep stuff in, like our organs, right? But it's also going to help keep water into our bodies and stop that dehydration process. It also helps us from any chemical attacks. Anything that's in the air or anything that might get on our body is going to be repelled by our skin. It produces a pigment called melanin. Melanin is there to protect us from UV light, which can damage our DNA. Our skin also produces something called keratin. Keratin is the kind of hard, crusty stuff that makes up that top layer of skin. It also makes up our hair and nails, and this is going to help protect against abrasions and help to repel water, make our skin it's not watertight, but it makes our skin more water resistant so that water just doesn't flow into our bodies freely. It can also help coordinate immune responses. Our skin's also in charge of excreting substances like salts, organic waste products, and water. It usually does this through our exocrine glands, which expel onto the skin surface. Our skin's also there for body temperature regulation, helps us sweat through evaporative cooling. It also serves as insulation, that subcutaneous layer. There's also vitamin D that is synthesized in our integument. It's calcitriol it's then converted into calcitriol in the kidneys, but the vitamin D, is being created through a special cellular reaction that's brought on by UV light. So lipid storage is another function. All of the hypodermis stores lots of adipocytes, thankfully or unthankfully in some cases. And then we also have sensory output, things like touching, pressure, right, pain, temperature, all those things, just little inputs that we get through our skin. So our epidermis, this is moving into the next section of your book. The epidermis is that top layer. It's what you see. The primary cell that is within the epidermis is called a keratinocyte. The keratinocyte is making up the majority of our epithelial cells. It's our body's most abundant epithelial cell. There's actually several layers of these cells in the epidermis, and this is why we call the tissue a stratified squamous epithelium, because it's made of several layers of these flat cells. The stem cells are in the deepest layer, and the keratinocytes are at the top layer, and that's where they're kind of being shed off into the environment. Some gross statistic like 70% of dust is actually dead skin cells, all coming off from your epidermis. There's also epidermal ridges, which help to increase our surface area on our skin. That gives us our fingerprints, which help us grip and grasp things, better attachment. Here you see what I'm talking about with those epidermal ridges, and they expose themselves on the top surface of the epidermis also. Here's those stem cells are in this bottom layer here, and then as the cells migrate towards the top, they kind of get pushed towards the top of that layer. That's when they dry out even more, and we'll look at that process. So our thin skin is the majority of the body surface. So this is the skin that's on our face and on our arms and our legs. There's only 4 layers that are associated with thin skin, and it's about as thick as a plastic sandwich bag. So it's still really, really thin, even though there's all these layers to it. Here you see thin skin, the dermis of the thin skin, and the epidermis. Notice this top layer, it almost looks stringy, like those cells are falling off, and as I mentioned, that's exactly what they're doing. They're falling off, they're being shed, and they're turning into dust all around your house and home. This bottom layer of dark pink, those are the stem cells, which are going to be pushed up to the top over time. So thick skin is only found on our palms of our hands and the soles of our feet. This is why we get calluses in those areas, because it's a thicker layer of skin. There's actually 5 layers in these parts of our body instead of just 4. And here our skin is much thicker, about as thick as a paper towel. Again, still pretty thin, right? A paper towel's not that thick. Here you see, and this is a huge comparison. Look at this thick layer compared to just that little stringy layer that was on thin skin. Here's the deeper epidermis, and that layer of stem cells is that first layer of dark pink. So let's talk about the overall characteristics of our epidermis. There's no blood cells in our epidermis. So if you cut yourself and you're bleeding, that means you've gone down into the dermis, which is pretty easy to do considering our skin's only as thick as a paper towel, right? The cells have to get oxygen and nutrients from the dermis, and those that have the highest metabolic demand are the ones that are close to the dermis, those stem cells that are undergoing mitosis and cell division very, very quickly. They're at that deep layer. So it takes about 7 to 10 days for those cells to get pushed all the way up to the top. So every 10 days or so, you have new skin, right? Although it's ongoing, so it's not like, on the 10th day, you look old and haggard, and then the next day you look, beautiful. Wouldn't that be nice? So let's talk about these layers. The deepest layer is called the stratum basal, or sometimes it's called the stratum germinativum. It's the same thing. It's just the deepest layer. It's this layer that's right on top of the papillary layer. It's that layer of stem cells. This is where those basal cells are. Those basal cells are the stem cells. Those stem cells will undergo mitosis and divide to create more cells that just get pushed further up. There's also special cells in there called Merkel cells. These Merkel cells act as a touch receptor. The next layer is called the stratum spinosum, the stratum spinosum is called that because the cells actually start to look a little spiny as they begin to dehydrate and fill with keratin. So there's also some special immune cells in this layer called dendritic cells. The stratum granulosum is the next layer. Here the cells start to look grainy or spotted because, again, they're filling with that keratin protein and they're still continuing to dehydrate. They grow a little bit flatter. They're not as puffy as they used to be. The stratum lucidum is only in the thick skin, the palms and the soles. And this is, again, just another flat layer of dead cells. And then the very top layer is your stratum corneum. That's what you see. That's what you can touch. And this is where the cells are completely filled with keratin. They're no longer living, but they're still connected, and they continue to shed off very quickly. So there you can see all the layers, and they're really Hard to detect unless you have a trained eye. This deep layer is the stratum basal, and then you have the stratum spinosum just above that. And if you look, the cells there look a little spiny. They don't look as puffy as they used to. And then the stratum granulosum, you can see they're starting to thin out a little bit. The stratum lucidum is this kind of clear line of cells, and then the stratum corneum is this big, thick layer of cells. So this is thick skin that we're looking at in this slide. Let's talk about fingerprints. They're basically just the ridges that are on the thick skin, and they're obviously used to identify individuals like that, a loop or a swirl. So this is a little review, some review questions that you can answer on your own. This is also part of your reading guide that was created for this chapter. Let's talk about skin color. Skin color is determined by pigments. There's two pigments. There's an orangey red pigment called keratin, and then there's a brown pigment called melanin. And these pigments are going to be in different ratios depending on our genetics, depending on the genes, because these pigments are proteins. Proteins come from our genes, so it's that whole relationship to our genetic inheritance. Skin color is also determined by the degree of dermal circulation. If you cut off circulation to an area of your body, that area of your body is going to turn whitish, grayish, maybe even bluish in color. So that can obviously affect your skin color. And here you see those melanocytes filled with dark brown pigment in that thin skin, and they're located in the stratum basal. Keratin, as I said, is that orangish, yellowish, reddish pigment, most apparent in the stratum corneum of light-skinned people. It's also found in orange vegetables. If you eat a lot of orange vegetables, sometimes it even concentrates like on your palms. I had a friend that used to eat a lot of carrots, and her palms were orange in appearance. Melanin is the yellow-brown or brownish pigment produced by melanocytes in that deep layer of the epidermis. And there you see, and the melanocytes are really big. They have lots of melanin in them, and that melanin can perforate through to different layers. Dermal circulation, as I mentioned, is another factor in skin color. Hemoglobin is a red pigment, so if you have lots of blood circulation, you're going to have a nice pinky appearance. The blood flows through the dermis and that papillary plexus, and the more blood flow, the more reddish in color you get, which can happen if you have a fever or if you get embarrassed. Sometimes the blood rushes to your face, that type of a thing. Less blood flow, the condition's called cyanosis. This is that yellow, this is that pale or bluish appearance. Typically it happens when you're cold, like on your lips and your fingertips. I'm thinking of like little kids when they get out of a pool and they're chattering and they're like, no, I'm warm, I promise. And you know, they're freezing their little butts off. So here's the overall picture of some of these structures that I'm talking about. The papillary plexus with the blood vessels going through the dermis. And again, that's how blood flow is regulated to our skin. Let's talk briefly about skin cancer. There's two types of skin cancers that are fairly common. One's a basal cell carcinoma. This is the most common form. It originates in that deep stratum basal. It rarely metastasizes, and this is a direct result of UV exposure. There's also squamous cell carcinoma. This is the second most common. This is found in, again, those sun-exposed areas. It's more likely to metastasize, but typically treatment for both of these is just surgically removing the tumor once it's early detected, which is why it's important to go to a dermatologist, get any skin irregularities checked out. Basal cell carcinoma. You would think that it's, you know, it looks like a bug bite that doesn't heal, or maybe it's a bug bite that doesn't itch, but, you know, it's on her forehead. Maybe she got burned a few times as a child, and there she goes. Malignant melanoma is the dangerous one. This is the most serious form of skin cancer. This is where those melanocytes are rapidly growing, rapidly metastasizing, and getting into your lymphatics. And once cancer's in your lymphatics, it can travel all over your body. So it has to be detected early. If it's detected early, the 5-year survival rate is huge, 99%. But if it's not detected, that 5-year survival rate goes way down. Key characteristics is just understanding what moles and skin irregularities should look like, if they're irregular, if they have irregular color, irregular border, or if they're changing, or if they're raised. You should be getting them checked out and maybe even biopsied. something like that is not something you want growing on your skin. Ooh, I'm going to flip it. All right, same thing here. This is some review questions. You can pause the video and try to answer them. These are also questions in your reading guide as you're reading through the chapter. So we'll move into the dermis. The dermis is that layer in between the epidermis and hypodermis. There's two main fibers in this area. You have your elastic fibers, which is allowing your skin to recoil, right? This is like when your skin bounces back, right? I pick up this little flap of skin on my hand and it just bounces right back. But if you do that to an 80 or 90-year-old person, if you know what happens when you pinch their skin like that, it stays like that. It stays pinned up like that and slowly goes back down. And that's because those elastic fibers aren't as stretchy anymore. They don't have that ability to recoil anymore. Collagen is strong and it's stretch resistant. It bends easily. This is what keeps your skin smooth looking. So as you get older, your collagen begins to get a little bit more stretched out, and therefore, your skin isn't as resilient looking, and you get all these little wrinkles everywhere like I have. So it's limiting the flexibility and trying to prevent damage. But as we get older, some of that damage is just a natural process of aging. So let's move into the dermal layers. As I mentioned, there's two. The papillary layer, which is just below the epidermis. This is full of that areolar connective tissue, all of those different fibers as well as cells. This is also where the capillaries are, lymphatics, neurons. Some of our touch receptors are in this area as well. Then you have the reticular layer. This is where there's dense, irregular connective tissue. The collagen fibers kind of serve as a connection to the hypodermis in this region. There's also blood vessels, nerves, and accessory organs like some hair structures and things like that. So there's a reticular layer. The hypodermis is the deepest. This is separating the skin from deeper structures like organs or muscles or other fascia that's below the skin layer. It's also helping to stabilize the skin and keep it in place. There's lots of fat in this area. And this is a site where energy is stored, right? That's the overall purpose of body fat, right? There's those adipocytes, nice and full of fat. They look like little bubbles, yellow bubbles, kind of creepy. Here's the review questions. You can pause the video and answer them yourself or answer them in your reading guide as you're reading the chapter. Let's talk about vitamin D briefly. There's two sources of vitamin D. There's sunlight, as I mentioned. The epidermal cells, when they are meeting with UV light, can perform a little chemical reaction to synthesize a steroid compound, D3, calcitriol is what it is. Then that vitamin goes into the capillaries and into the bloodstream. You can also get vitamin D, a different version of vitamin D, from your diet. And this is coming from like dairy products that are fortified, or things like fish, healthy fish oils, shellfish, etc. have vitamin D in them as well. It should be noted that vitamin D, there's several different types of vitamin D. So you can't just depend on going out in the sun to get your vitamin D. You should be having some dietary vitamin D in your life as well, because there's different versions. But ultimately, that vitamin D3 is converted into an intermediate product by the liver, and then the kidneys use that to synthesize something called calcitriol. What calcitriol does is it's stimulating calcium and phosphorus absorption by the kidneys, or by the intestines rather. So in other words, if you have vitamin D in your diet, you're also going to be absorbing more calcium from your food, which is why a lot of times milk products and dairy products are fortified with vitamin D, because vitamin D and calcium like to come into the body together. And of course, we need those for bones. This is the overall summary. You have sunlight creating this vitamin D, converted by the liver, then converted by the kidneys, going into the small intestine and increasing our absorption of calcium, all for healthy bones. If you have inadequate vitamin D, maybe you stay inside too much, or maybe you have darker skin, which does not allow you to absorb the UV light as much. That could mean that you have inadequate calcium and phosphorus levels. So you could have poorly mineralized bones. You could have developed rickets. It's not very common anymore, but still possible. Growing children are more apt to have rickets because they're rapidly undergoing calcification as their bones are growing. In adults, you would just see a decreased bone density, increased fracture risk, etc. And elderly have a higher percentage of D3 production in their skin, mostly because they're more sedentary, more likely to stay inside, and because their metabolism isn't working as quickly as it was when they were younger, so their body isn't able to make that vitamin D as efficiently. That's just a patient with rickets. It just means your bones are very flexible because you don't have as much calcium in them. There's just a lot of collagen, which makes them bendy. Here's the review. Again, you can pause the video, answer the questions, or you can answer these questions in your reading guide. Let's talk about accessory organs of the skin. This is the last little section of the chapter. We have hair follicles, exocrine glands, and nails that are the accessory structures in our skin. And you can see where they are, all these different components here. Hair follicles basically protecting, producing sensations. You are aware of like a breeze blowing when the little hairs on your arms move around. Your glands are there to get rid of waste. They're also there to lubricate and protect. And your fingernails are there for helping with grasping as well as protection. So let's talk more in depth about hair. It's found almost everywhere of the body. It's produced by a little structure called a follicle. And there's a hair shaft, which is the part that you see. I need to get my shafts cut. They're pretty long for me. The hair root is what anchors your hair to your skin. And then the root hair plexus is the special nerve ending that's associated with the root. And that allows you to know when your hair is being moved around by a breeze or by someone else touching you. The erector pili is a small muscle that's associated with every little hair on your arm and legs, and this is what becomes erect and allows your hair to stand up when you get goosebumps. There you see all of these structures together. The root hair plexus, that little nerve ending. You can see the sebaceous gland or oil gland that's associated with this hair follicle, and that's why our hair is oily. It's lubricated so it doesn't just dry out and crisp away. And the root goes into the dermis, whereas the shaft comes out of the epidermis. So overall structures, the hair papilla, that's just the little peg of connective tissue that has all the blood vessels and nerves at the base. The matrix is where your hair is actually growing. The medulla is at the center core of your hair. The cortex is that deeper layer to the cuticle, and the cuticle forms the surface of the hair. So that's what you actually see on your hair. We can look at a little cross section here. So this is like the piece of hair was cut in half, and you can see the matrix is this innermost part down by the root, and then the medulla is this inner kind of meaty part of the hair follicle surrounded by the cortex and then the cuticle. So the cuticle is the outermost part. The color of your hair is within the medulla. So if you have pigment in that area, then you're going to have brown or black hair. And if you don't have pigment, then you're going to have yellow hair. Or if you have lots of iron in that area, you can have red hair. And you see that erector pili muscle really good in this picture. That muscle right there. I think I clicked there. Whoops. I clicked on the image. Sorry about that. All right. So again, the medulla is a soft keratin. The cortex has hard keratin to make your hair stiffer, and the cuticle is very tough. That's the outer part of your hair. Here, this is a better picture of an actual cross section of a hair. So this is as if we chopped a piece of hair in half and we're looking into the hair. You can see that cortex, or the medulla, sorry, surrounded by the cortex, surrounded by the cuticle. And then once we get into the deeper layers, that's of course surrounded by the hair follicle itself, which is that deepest layer into the dermis. Our hair grows in cycles. There's an active phase where it's growing for 2 to 5 years. And then there's a resting phase. And your hair is, each hair follicle is going through these cycles at different rates, which is good because otherwise we'd all lose our hair and then we'd all have to regrow our hair all on the same cycle. So, you know, when you brush your hair and some hair comes out, that's part of the natural cycle. Those are called club hairs. That's after the hair has no longer been growing and it detaches from the follicle and it just falls out. That's a natural thing. Of course, those follicles can then be reactivated once that club hair is removed, and then new hair can grow inside that follicle. It's just a cycle of regression and transition and reactivation. Our hair color, as I mentioned, is just variations due to that melanin that's inside of our hair. So there's dark brown, there's yellow brown, or red that melanin can create when it's just with itself or with other chemicals that might affect it, like iron, as I said, creates the reddish pigment. And pigment production usually changes with age. It declines generally, which is going to lighten hair color, sometimes causing hair to turn white or gray. That white hair is from the lack of pigment in that medulla area. So here's that review that you can pause and answer, or go back to the reading guide as you're reading the chapter. Let's talk about sebaceous glands. The sebum, or oil, is a holocrine secretion, which again just means those cells kind of burst. It's a mixture of triglycerides or fat, cholesterol, proteins, and electrolytes. It's serving to coat and protect the hair shaft and the surrounding epidermal structures. It provides lubrication for the skin, keeps it moist, and helps to form that waterproof boundary. It also has antibacterial properties. All body secretions have antibacterial properties to help protect the body against invaders. Remember, the skin's first job is protecting. There's also contraction of the erector pili muscles, which help to squeeze the secretion out of the sebaceous gland. So when you get goosebumps, a little bit of oil is also coming out to help coat the surface to keep you warm. The sebum that goes on the face, back, chest, all those areas of our body is a special type of oil that's, again, there for coating and protecting. So you have typical sebaceous glands and sebaceous follicles. Typical sebaceous gland is associated with a hair follicle, and then there's other sebaceous follicles that, as I said, are on your face, on your back, different areas of your body. They might not necessarily be associated with hair. Let's move on to sweat glands. There are apocrine and merocrine sweat glands. Apocrine sweat glands are the really stinky sweat glands. These are the ones that are in our underarms and our pubic areas, right? This is where the sweat is actually going into a hair follicle. It's a more sticky type of sweat than your merocrine sweat glands. Your merocrine sweat glands are all over your body. This is a watery secretion, and they secrete directly onto the skin surface, not through a hair follicle. And the difference really is those apocrine sweat glands with their kind of stinky secretion. It's a survival mechanism, and it's also pheromones. At some point in time, and some of you may be like this, people enjoyed those smells, and now our culture's kind of taught us that those smells are stinky. But in a natural setting where we're not, using perfumes and smelly lotions all the time, those scents were very attractive to different gender or different sexes. So here's the review for this section of the book. You can pause the video, answer the questions, or you can answer the questions in your reading guide. Finally, we get to nails. They're basically there to protect our fingertips and toes. There's a nail body. That's the main part of the nail. The nail bed is the epidermis underneath of the nail body. And there's a nail root, which is where the nail is produced. The cuticle is the part of the stratum corneum that kind of wraps around the nail root. And then there's that little arched half moon structure that's on the base of all of our nails. Can't really see them on mine because I got fake nails right now. But it's called the lunula. Kind of a cool name. Here are, whoops, I went back. Sorry about that. Here you see some of these structures. The nail bed is that epidermis. The nail body sits on top. There you see a finger bone. This is all the muscles of the finger. The lunula is this little half moon area. And the cuticle, of course, is the surrounding epidermis. Let's talk about why nails are important. Your nails can be used to kind of indicate any underlying changes that are going on in your body. Changes in nail shape, changes in structure or appearance can help give diagnostic information. Clinicians will sometimes ask to see your hands if you're suffering from digestive issues or other issues. Psoriasis can cause rapid stem cell division, resulting in pitted nails or distorted nails, and concave nails can actually be a result of a blood disorder. So nails are very important in diagnostics. Something like that, that's a result of psoriasis. Here's our little review. You can pause it and answer them, or you can go back to the reading guide and answer the questions while you read. Finally, let's talk about age-related changes in the integumentary system. As you will see throughout this entire book, everything slows down when you get older, and usually those age-related changes start at around 30, age 30. So melanocyte activity decreases. So your skin is more sensitive to sun exposure. Sebaceous glands secrete less oil, so your skin's more likely to dry out and get scaly. You have an increased risk of injury, tears, infection, all of that because your basal cell activity is slowed down. You have weaker connections between your epidermis and dermis, and your vitamin D production declines as well. You also have decreasing numbers of dendritic cells causing immune system delays. Your dermis is thinner and has less elastic fibers, so you get the sagging and wrinkling. The sweat glands are less active, your blood supply is lower, so that's going to affect your temperature regulation. Your skin repair slows. Geez, this is all doom and gloom, isn't it? Hair follicles stop functioning, so your hair is going to get thinner. Decreased melanocyte activity in the hair is going to give you gray or white hairs. And your sex hormones can alter your hair and fat distribution on your body. You may have never had hips in your life, but then all of a sudden you're 35 years old and now you have fatty hips. Why? You can thank the estrogen for that. So here are some other, just a summary of the age-related changes: fewer melanocytes, drier epidermis, thinning epidermis, etc. for all of my visual learners. And here's our review for this section. Finally, integumentary repair. If we damage our integumentary system, we're going to have a blood clot or scab on the surface, but deep below the surface, there are lots of changes happening. The cells of the stratum basal are going to migrate toward that wound. There's special cells called macrophages, which come in and remove debris. They're like little Pac-Men coming in, gobbling up the broken cells. If there's damage to the dermis, there's going to be fibroblasts, which are little stem cells in there, blood clotting. There's a whole capillary network that's going to reform as part of the repair process also. So after 1 week, you'll have that scab that could be undermined by all those epidermal cells, so it could start to fall off again depending on how deep the wound is. There's phagocytic activity that's almost completed after a week. The blood clot will start to disintegrate. The fibroblasts have formed those collagen fibers, and that will result in a scar. So after several weeks, the scab comes off. Epidermis is now complete. There might be a little indentation on your skin where that injury was, and you'll have that scar tissue there for a while until the skin can repair itself completely. The younger you are when integumentary damage occurs, the quicker and less noticeable the scars will be. The older you are when the damage occurs, the more intense the scar will be. That's just a factor of age and our slowed metabolism. This is just the diagram showing the process here. Those cells coming to the area, forming the blood clot, scab forming on the surface, but below the surface, lots of magic is happening. These fibroblasts are secreting collagen, and eventually the collagen works its way all back up, and now we have a scar. So that scar is basically part of the tissue repair process. The hair follicles, sebaceous, sweat glands, all that stuff is usually not replaced by scar tissue. So depending on how bad the damage is, you might not gain feeling back to that area, which is why burns are so terrible to happen to you, because burned skin is then not going to be able to feel sensations anymore, typically. So scar tissue that's formed beyond repair is called a keloid. It's kind of a raised surface of a scar, and it's usually common on like the back or chest, sometimes even on your ears. In that case, this is a keloid, and I think something happened to him, or maybe he chose to have this kind of artistry work done to him, but those are keloids. Lots of scars there, lots of scar tissue. Last little review slide. You can pause the video, answer these questions, or answer them from your reading guide. I hope I did not talk too fast, and if I did, you can go back and re-listen. So enjoy the rest of Chapter 4, and I will see you guys next time. Bye-bye.